Good afternoon. My name is Sandra Leek, the Director of Health Services for Carrollton-Farmers Branch ISD, and today we are going to review some COVID-19 safety protocols for staff. As staff begin returning to work, you may receive questions about the measures that we are taking as a district to safeguard our staff. This training is designed to support you and help you to be able to answer questions and refer staff to credible resources as needed. So let's get started. The district recommends that staff should self-screen for symptoms of COVID-19 before reporting to work. Once staff arrive at work, there are some exclusionary guidelines that we have received from the Texas Department of State Health Services and the CDC. Those exclusionary guidelines begin with temperature of 100 or greater. So if a staff member arrives at work and feels feverish or has a measured temperature of 100 or greater, they would need to go home. Any complaints of feeling ill, such as chills, muscle pain, achiness, headache, sore throat, cough, shortness of breath, or the loss of the sense of taste or smell, are considered symptoms of COVID-19, and that staff members should not enter the building or should go home. Other exclusionary guidelines are contact or suspected contact with a person with COVID-19. So if an employee reports to you that they have a family member that they suspect has COVID-19 or they've been diagnosed with COVID-19, then that staff member would need to isolate for 14 days since last contact so that they do not potentially spread COVID-19 to their coworkers. Additional safety measures being taken will be the availability of hand sanitizer at all of the entrances of our building. So we ask that staff sanitize their hands as they enter the building. Another safety measure, of course, is washing your hands often. There are on the slide a couple of videos that you can use to send to staff to remind them to wash their hands appropriately. We, of course, want to wash our hands often with soap and water for at least 20 seconds, especially after having been in a public place, after blowing one's nose, coughing, or sneezing. And if soap and water are not readily available, the staff member should use hand sanitizer. And to be effective against COVID-19, the hand sanitizer should be at least 60% alcohol. We want to cover all surfaces of our hands with the sanitizer and rub them together until they feel dry. And of course, we want to avoid touching our eyes, nose, and mouth with unwashed hands. Who knew that that could be so difficult? But I think we've all been noticing that since we've been so conscious of touching our faces in this time of COVID-19. Additional safety measures are the covering of mouth and nose with a cloth face cover when around others. COVID-19 may be spread to others even when you do not feel sick. So the cloth face cover is meant to protect other people in case you are infected and don't know it. Please bring your own face covering, and there is on the slide a link to the CDC website that gives you more information on this topic. An additional safety measure, which you've probably heard a great deal about, is social distancing. Social distancing is putting distance between yourself and other people. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet, which is about 2 arms length away from other people. Do not gather in groups in, say, for instance, the break room. Stay out of crowded places and avoid mass gatherings while you're at work. Keeping distance from others is especially important for people who are at higher risk of getting sick, and those are people with asthma, diabetes, older adults. So they need to be especially careful about this. Additional safety measures are covering coughs and sneezes. The virus that causes COVID-19 is spread by respiratory droplets of infected persons. Persons infected may exhibit few or no symptoms of illness. And of course, once again, older adults and persons with underlying medical conditions are at a higher risk of contracting the virus. Another safety measure is cleaning your work surfaces. So we recommend that you clean all the high-touch surfaces in your work area at the start and end of every day. High-touch surfaces include things like your phone, your counter or desktop, doorknobs, bathroom fixtures, toilets, keyboards. So any of those areas that you touch a lot during your workday, it's recommended that you clean those, and cleaning supplies will be provided by the district that are effective against COVID-19. So please use those provided cleaners and disinfectants. Temperature screening. So thermometers have been ordered and designated staff will be trained in the use of non-contact thermometers. Temperature screening is recommended to be conducted upon arrival to work in the morning. Staff with signs and symptoms upon arrival to work will be sent home. So a question that has arisen is, what do I do if someone is fine when they arrive in the morning, but they become ill during the workday? So then you would send the person home. If the employee has become too ill to drive him or herself home, then you would want to separate that staff member from other staff until arrangements can be made for the person to be picked up and brought home. Most people with COVID-19 have mild illness and can recover at home without medical care. The person should not, once they've returned to their home, they should not leave their home except to get medical care. They should rest and stay hydrated and take over-the-counter medications such as acetaminophen to help them feel better. Of course, they would want to stay in touch with their doctor. But if they are going to go to the doctor's office, they will need to call before going for medical care, or if they go to an emergency room, they would need to notify them that they are on the way and that they believe that they may have symptoms of COVID-19. There are some links on the page for further information. And of course, the person should avoid public transportation, ride sharing, or taxis. Another question that has come up is, well, what if I have an employee that is diagnosed with COVID-19? When can they return to work? So employees diagnosed with COVID-19 may return to work when the following criteria are met. That when it's been at least 3 days since they've recovered without the use of fever-reducing medication, so they've had no fever for at least 3 days, and they have improved respiratory symptoms, so their cough, shortness of breath, those symptoms have resolved. And it has been 7 days since the symptoms first appeared. If an employee has COVID symptoms but was not tested, the employee is then assumed to have COVID-19 and may not return to work until they meet the criteria that we just discussed, or if they have symptoms that could be COVID-19, but the employee wants to return to work before the completed isolation period, then the individual would need to provide a physician note clearing the employee to return to work based on an alternative medical diagnosis. Another question that has arisen is, well, what is close contact? So employees with a known close contact to a person with lab-confirmed COVID-19 will not be permitted to return to work until the end of the 14-day self-quarantine period from the date of last exposure. And CDC defines close contact as close proximity within 6 feet for a duration of about 10 minutes or more without the wearing of personal protective equipment. Any other questions may be directed to the Director of Health Services, myself, Sandra Leek, at 972-968-6512, or you may email me at leaks@cfbisd.edu. I'm here to support you. Thank you for your cooperation with these health protocols and for your patience as we navigate this pandemic in a way that maximizes safety for all students and staff.